good. Hi everyone, I trust we're all good. All right. So this night we're on a very long discussion. Hope we're set for it. If you're just connecting, please do well to give this live stream a thumbs up. Hi everyone, hope we're good. Annie, good evening, good afternoon. I don't know where you're connecting from. Anyway, good day. My twinnie, greetings from this end. I trust you fine. I trust you good. Thank you so much, Annie. Thank you so much. I'm grateful. Thank you so much. I'm grateful. Yeah, thank you so much. Thank you so much for having you people here. Thank you so much. I'm really grateful. All right, I'm so sorry for the delay. I was supposed to be here by exactly 9 p.m. West African time, but something interesting happened. I know people want me to share what happened. So my twinnie say you look different today. Yes, so I look different today. Annie, thank you for that. Thank you so much, everyone. Yes, so I'll share with us what happened. Thank you so much. Thank you so much. You're welcome to this night discussion. I trust our day was good. Right? I trust our day was good. Before I came back, you have ended the live. Yeah. Favor was just doing a silence live stream. She was doing a silence live stream. It wasn't like a big time live stream. She was just doing a silence live. Yeah. Yeah, thank you so much, Twinnie. Thank you so much. Thank you so much. It means a lot to me. Thank you so much. All right. I think without making further ado, let me share with us first of all how my day was and then what happened. My day has been a very busy one indeed. It was raining I think greater part of today. It was actually raining. So it's in some way it hindered some people to do a lot of things. So likewise myself, as I said in one of my live stream, at the moment I'm trying to catch up as much morning as I could catch up with. So I do a lot of work. I do a lot of things just to meet up, and I'm going to tell us why I keep myself that busy. So yeah, somehow, but not really the one. Yeah, not really that one. So what happened this evening was something that happened with my colleague. Not really my colleague. It was a colleague of mine that shared that experience. She said that there was a certain, it was a life story though. It was a life story. So there was a certain nurse in Calabar, to be precise. So that's Calabar, Nigeria, southern Nigeria. So one of those evenings, she was about handing over, and upon that time she was about handing over, they rushed in a client, they rushed in a patient. It was an emergency. So it was already late because the person that was supposed to come and take over did not arrive on time. So she just had to hurry up, and do what she could. But the person, I think thereabout was the exact time that person stepped in when that emergency came in. Did it? No, no. She just walked out. She saw the person coming, so she walked out. So not knowing, unknowingly to her, that the person that she left, that very emergency, was her husband. So she said anything that want to happen should happen, I beg. Anything that want to happen. So she left because they kept her very late. On getting to the house, they now called her that, have you heard that your husband had an accident, so on? They have rushed him to the general hospital. She was like, how did it happen, and so on. So they now told her that she should go to the hospital to find out, that they rushed the husband to the general hospital. On getting there, she now found out that the client they rushed in was her husband, and the man had already passed on. So if that she had stayed back to attend to him, maybe something would have, there would have been a way to attend to him. But Twinny. That's what happens most time when colleagues don't come on time to take over duty from each other. There are people, I don't know, a couple of us could share from that experience. There are those that they are just good at coming very late and so on. So that's you say, but most times family cannot treat family. It all depends though. It all depends. Like in our own case, at least she would have just tried to check who exactly was that. She would have found out who it was first. Yes, yes, I understand with you. Even me, I don't handle my close persons. 3 days ago, I had someone who is very close to me, and the person had a condition that I could just happen. It was gynae related condition. I could handle that very well. But because the person was very close to me, I don't want something that tomorrow they talk and all these things. So I had to refer. I had to refer her to another colleague of mine. So the person had to handle him. I even told the person this is the reason why I can't handle that very client, because I don't want some kind of things that comes in, which most of us we know the ethical aspect, and especially in the African settings. Say your client had an emergency, sorry, your relative had an emergency and they brought, and the person lost his or her life. Everybody might even say it's because of you and so on. So that's why it's not advisable you handle your relative. So in this case, what happened this evening? A client came in, and the client came in. I had already spent an hour beyond what I intended to. So I was like, I need to go. I just need to go. I've already explained to everyone, the nurses and everyone, that I want to go. So the client was like, please just see me. Everybody was just begging, please just see him. I don't know, for those of us who work in the hospital facility, have we ever had that experience where a particular patient would say, I want this person to attend to me? How many of us have had that experience? I don't know how many healthcare personnel are with me right now. I don't know how many are with me. Yes, exactly. Yes, Twinny, it happens. There are clients like that will come that will say, I want this person to attend to me. Yes, it happens. So this very client was like, please, sir, just help me out. So the nurses were like, okay, just do what you could and so on. So I had to stay back, clock the patient and everything. And my dear, that's how I arrived very late at home. That's how I arrived very late at home. So here we are for this night discussion. So that's how I spent my day, though. That's how I spent my day. So it has been a very busy one. And interesting enough, I have not had lunch. I even skipped my breakfast self because I was trying to catch up with a lot of things. So for those who are just joining up this very moment, you're welcome to this very live stream. I still remain Yeah, I did though. I did. I skipped my breakfast. I've not had my dinner yet. I've not had my dinner yet. I'll do so after the live stream. I know a couple of us are very conscious with time. Even me, I'm very conscious. I'm someone that is very conscious with time. If I keep a particular time, I like the person keeping to that time. So if the person doesn't keep, I will pardon it first time, second time, and so on. And then if it continues, I'll just feel like that's how the person looks like. So there are a couple of my family, this online family that keeps to time like that. So I just want to keep to time with them. Anyway, we're here. We have to make sacrifices and so on. So I'm fine. I'll do so. I'll do so. Yeah, I'll do so. I'll do so. I'll do so. Although I'm not feeling that hungry as at the moment. I'm not feeling that hungry. I don't know why. For me, I can stay as long as. So, Blessing, thank you so much for connecting. Thank you so much, dear. It means a lot to me. It means a lot to me. So, anyway, let's see how to push. Let's see how to push. So, I still remain Wisdom Akbar, and on this very live stream or this very channel, you get health related content. You also get business related content. You get content as relates to motivationals, as well as content that relates with religious management and so on. Sorry, religious aspects and so on. So, if those are where your interest lies on, yeah, Blessing, don't worry, I'll be fine, okay? I'll be fine. I'll sort out myself, okay? So that's why I'm hurrying up to catch up. I'm checking the time too. Yeah. So, if you're yet to subscribe to this very channel, please do well to subscribe. Hoping to have. Yeah, Blessing is not a YouTuber. Blessing is not a YouTuber. Blessing is not a YouTuber. Twinny, Blessing is not a YouTuber. Yeah. She would have been a very nice person to connect with. She is very supportive, yeah. But she's not a YouTuber though. So for this night. I want to talk about something on health. Yesterday we talked about something that is not health related, more or less conventional life experiences. But for this night, we want to go to something that has to do with health. So it will be one day in other aspect, and the major should be that of health. So that at the end of the day, we need to keep, just as I shared in one of my live stream, some of my experiences helped me to get something, in fact, to get keys to several things that if I should want to monetize them, if I should want to use them to get money, I would charge persons good sum of money. For instance, toothache. Toothache, for instance, there is a treatment I have for toothache that if I should recommend it for you, it will only take you the maximum of 3 days. You may not need to. I've had clients that come, they have recommended them already for, maybe they visited other places, I've recommended them for tooth extraction. And I'll just recommend it, I'll tell them, except in cases where the decay have already happened. The decay has been that severe. If not, if it hasn't, the decay has not, or let's say it hasn't gotten that severe, I could recommend that very management for that person. And the time frame is between 6 hours to 72 hours. You will recover fully, because I had a very, very, very bad, I had a worst experience when it had to do with toothache. Okay, so Annie says, I'm having toothache. Oh. Okay, Annie, we'll talk after this live stream because it's not supposed to be public. It's not supposed to be public. Okay, before WHO will come and catch me. Before WHO will come and catch me. So we'll talk about that privately. And you assure me that it's going to be private. Yeah, do you mean that? Do you know? I don't know. Those of us that follows and train, have we discovered that someone have discovered a treatment for hypertension, and the person was arrested. Who saw that trending video? Who amongst us saw that trending video? Someone have discovered a cure, not like management, cure for hypertension, and that person was arrested. Yes, there's a trending video about that. A particular man, yes, someone have discovered the treatment. It's just like this HIV, for instance. There are persons that have discovered the complete treatment for HIV. Just that what WHO does is that they have, or what's in the, how do I put it, drug testing system, what it does is that they have to sustain, how would I put it? They have to put this um your medication or your management, how will I put it? Yeah, I think drugs. Yes, that's the right word. They have to put this drug under certain trials. They have to make sure that it is good for, exactly, it is good for persons in, there's persons globally, it is good, exactly, trials. Yeah, they have to put it under trials to be sure that if persons in Nigeria take it, it will be the same side effect they will have with persons from the Asian countries, with persons from the Indonesian country. They have to put it through this trial. They have to ensure that not after certain group of persons have taken, the other group of persons will have adverse effect or even adverse effect. So adverse effect is that kind of effect where certain group of persons take medication that normally a larger group of persons would take it and will not have that effect, but that group of persons, when they take it, their own will be so grave that you'll be shocked. For instance, imagine someone taking paracetamol and his entire tongue start rolling out. That is quite abnormal. Or imagine someone taking paracetamol and the eyeballs start bulging out. That is an adverse effect. So they have to ensure that there is nothing like that. They have to ensure that cases of hypersensitivity is not recorded or are not recorded. So those are some of the things that makes it looks like some of these disease conditions do not have cure. So medicine have advanced. That's why you see people live longer these days compared to back then, where if someone just fall down with certain conditions like that, before you know, 6 months, 1 year, they are gone. So a lot of persons have discovered. So for mine, I don't want to battle with WHO. I'm not ready yet. I've not had that emotional muscle to battle with them. So I just recommend it to them on private basis. And I'll tell them, there was a client who met me and I told her, do you want this my treatment? Okay, this is what will happen. She was like, they have already recommended. She visited a dentist. They have already recommended tooth extraction for me. And I told her, I examined the teeth. After examining everything, I knew it wasn't that bad. I told her, try this my own. If in 3 days you don't give me the feedback that your teeth is okay or your tooth are okay, then just when, in fact, any care I render to you, just disprove of it. For this very one, try it. And she was like, yeah, that's okay. Do you want us to bet at it? I can bet anything at all for it. Try it. At the end of the day, she was very shocked. She called me back. She was like, are you serious? I was like, yes. Because some of these things, there are certain conditions that they were not just because of what I read in the book. They were my own experience. I've suffered some of these conditions. So when I'm now recommending you or when I'm interacting with you, I'm not just interacting just like any routine person, but someone who have had that pain, that experience. So that is by the way for toothache. So this night's discussion. Do you know it's very bad when you go to hospital and you take your client after spending huge amounts of money, you end up losing that client. It can be so traumatizing. It can be so traumatizing. Thank you so much, Marilyn. Thank you so much. I'm so glad having you here. God bless you. Thank you so much. It can be so traumatizing. I don't know how many of us have seen those kind of patients. It can be so difficult, especially those of us in the health line. It can be so difficult consoling those set of patients after they have spent good sum of money and so on. And then they now have that same client, they lose that very client. It can be so painful. Hence, the need for this night discussion. Hence, the need for this night discussion. We want to dig out, we want to explore those factors that could cause poor prognosis, those factors that could actually lead to poor prognosis. I don't know who wants to share experience with us. For those in the healthcare sector that are active with us, if you are just connecting and you're yet to give this very live stream a thumbs up, please double tap on your screen, or you click the three button at the top part of that. Should be the left hand side. I think that should be the left hand side if I'm not mistaken. The three dots above there, click on it, you see a place to like. That's what it means. So you thumbs up for me. Then in the comment box, please try to be giving me your comments. That will help to show YouTube that something is going on here. Okay, so try to give me your comments. Let's keep the section active. So you want to share with us, what do you think are some of those common factors that could lead to certain disease condition that after much expenses in terms of finance, much stress and so on, they still lose that client? What could be some of those factors that are responsible? Those are some of the things we want to hit ourselves this night. But let me hear from us. Let presentation and identification. Thank you so much, Twinnie. Yes, this is a major aspect. This is a major one. Indeed, this is a major one. Religion. Yes, it's a major one. This afternoon, I saw that of religion. It was very painful. It was very painful. This one of religion. We did all the health education, all the psychoeducation and everything we needed to do. But I mean, for those of us who grew in the north, if you have heard that word, dambanza, so it was like a waste of time. Wrong diagnosis. Yes, wrong diagnosis. Let me share an experience in relation to this late presentation and identification. Now, there was this client in Cross River State, which Cross River State lies in southern Nigeria. So I happened to manage this client. This client came in from Akamkpa. Akamkpa is a local government in Cross River State. So he was rushed. In fact, he came in on his own. He came in with his wife. He worked on his food. This is what happened that morning. Akamkpa happens to have some aspect of it that have a lot of rocks and mountain and so on. It's a rocky zone. So it's not just a rocky zone too. It's like a forest area. So this man went to the farm that day. He had to climb some hills and so on. So he felt a sharp pain in his chest, but he didn't want to play down on that pain. So he took a vehicle with his wife down to I don't want to mention for privacy purpose or for privacy reason. I don't want and confidentiality. I don't want to mention the location further than what I've done. So he took the wife down to the facility, and then they came in and they were trying to attend to them. That's the record personnel. They were trying to attend to them. So they just waited. We know another one which I want to add up alongside this discussion is bureaucracy. How many of us know that bureaucracy plays a role? Bureaucracy plays a role. Yeah, thank you so much, Chefuya. You're welcome. You're welcome. We're so grateful having you here with us. Thank you so much. We're discussing on some of the factors that leads to poor prognosis. of client care. Those factors are what we are discussing on this evening. So I was trying to, Nurse Favi told us, gave us 1 point. She said late presentation and identification. So I'm trying to share an experience in relation to that. So while they were trying to attend to her, along the way, because the crowd was much, in fact, he came and met not less than 50 persons already on the queue. He met not less than 50 persons already on the queue. So at some point, he was like, please, please just try to attend to me. He was telling the record persons, please try to attend to me. I don't understand myself. Please just try to attend to me. So the record person, as you know now, when crowd are much, maybe people that met other persons are trying to hasten you up. People like, you that is just coming now. What are sorry, I'm trying to add broken vernacular. You that is coming now. Why are you trying to hasten me up? So that's just the same scenario that played out. The man was like, please attend to me. I don't understand how I feel and so on. But because physically he did not see anything that looks like an emergency, they would have just referred him straight to emergency. They would have just referred him straight to emergency instead of the normal general, how do they call it? Is it, there's a word for that. Is it family medicine? But there's another word for it. More or less, those persons that do not have emergency condition, there's a name for, is it not OPC? Is it OPC? There's a name for how they address that very unit. So they would have just sent him to emergency, but he said he didn't want to, that it's not that serious, but he's not feeling okay. They should attend to him. 10 minutes later to 15 minutes later, he was now holding his chest. He said, I'm in pain. Please, you people should just help me out. I'm in pain. The next thing, before you know, he started coughing. This cough became serious. The cough kept increasing. So the next thing, when the cough was no longer unbearable, they saw him. He was sweating profusely. They had to take him now to the emergency unit. And when they took him to the emergency unit, other patients were there, other emergency cases were there that they just arrived before they rolled him in. So trying to sort out, and we know one of the issues that Nigerian systems suffer, WHO will recommend that, for instance, for the nurses, for instance, one nurse to one patient or two nurses to one patient. But what you will see is one nurse to 50 patients, one nurse to 30 patients, or one doctor to over 100 patients. Those are some of the things you see in Nigerian system. So they were trying to attend, but they were short-staffed as at that point. And the client was coughing profusely. They're like, he's just cough now. Okay, what would they do? Let us see what to attend, maybe attend to the cough and so on. And the next thing, the man just fall down and lie on this thing, was holding his chest and so on. Everybody were thinking this man was just acting out just so that they would attend to him. They now sent for them to hurry up and go to the pharmacy to get the medication. Now, in that facility, it's a very big one. So every unit is not like the one that pharmacy is just like a mini pharmacy and so on. So it was up to standard. Pharmacy department on its own. So the drugs you have to finish from the emergency or any unit. You have to collect prescription and come to the pharmacy before they dispense. So in this man's case, immediately was lying down, holding his chest, and they sent for medication. The next thing we saw was that he started vomiting. From vomiting was blood coming out. The wife, everybody were just confused. So they had to come and see how they were running up and down just to go and get medication. Before they would do anything, the time frame between when they bring him from that place where the record people were attending to him and the time frame that man shut down did not span beyond 4 minutes. Practically did not span beyond 4 minutes. That man ceased breathing. Everything, he just shut down instantly. Now, the time frame after he has shut down, and when that man became totally cold, even up to the next 3 minutes again, man was completely cold, completely cold. Now, that would relate to this late presentation. If you calculate the distance from and the facility, it's not close. It wasn't close in any way at all. Now, calculate the time spent not attending to him. I don't know if you can now relate why late presentation and late presentation and identification could play a role. Exactly. Someone, yes, blessing say negligence. Yes, indeed, negligence plays a role. Negligence and malpractice, they play a role. Negligence and malpractice, they play a role in why certain conditions that would have been well managed on time were not managed. Negligence play a major role. So I am so grateful for these points. They are very valid. They are valid points. The points we have raised are valid points. Wrong diagnosis too could play a role. Now, do you know that wrong diagnosis too could result from wrong diagnosis may not even be from the part of the clinicians, can even result from the part of the complaints the client is giving. That's why we always advise clients, if you go, please don't minimize. There are clients that minimize their symptoms. Some of them, if you ask them, let's say it was a gynae related case, and you ask them, when last did you had sex? For instance, sorry for being that raw. Let's say they ask them, when last did you had sex? Do you know that some of them will tell you 2 years ago? Some of them will even say, doctor, or nurse, I don't do that kind of thing. And you are seeing that these very symptoms, they are sexually related transmitted diseases. So sometimes wrong diagnosis can result from clients' minimization of their symptoms, their presentation. Yeah, thank you so much. Real Talk with Mercy. This night we are discussing on, and what we are talking about is, if you have heard or you have seen a case where after the client was rushed into the facility, they have spent a whole lot of money and their resources, including time, and the client at the end of the day will now pass on. What are those factors that could be responsible? Those are some of the factors we are trying to dig out this night. Faith mentioned to us late presentation and identification. She also talked about religion. Then Marilyn talks about, she mentioned wrong diagnosis, and then Blessing mentioned negligence, which I say negligence and malpractice. These are some of the factors that could be responsible. So I was just trying to buttress a bit on wrong diagnosis, that most times the wrong diagnosis may not even come from the clinician's aspect, may even come from what the client presented. So when the client say, give little symptoms, because the truth about it is that most medical conditions overlap. Most medical conditions, they overlap. So not all headache are actually malaria. Not all fever are actually malaria. And for those who are in the African climes, specifically the Nigerian setting, please, there is a clear difference between malaria and fever. Please, if you have not known that today, if you have not known that before, please know that today. And let me differentiate that just to help those persons who may have been calling malaria fever. Let me differentiate the difference. Malaria is actually a condition, a disease condition caused by Plasmodium. Now, Plasmodium is a parasite. It's a parasite. And that parasite have 5 major classes. We have the ovale, we have the falciparum, we have the malariae, and so on. So those parasites now, they live in one specific how will I put it? Animal. Will I call it animal? Will I call it insect? Yeah, that's the right word, insect. They live in one insect called mosquito. That parasite live in an insect called mosquito. And when this mosquito perch on you, it will now, not referring out cases the facility can handle in time. Exactly. Marilyn, thank you so much for that. Exactly. That is another one on its own. That's another one on its own. So I was trying to explain exactly the difference between malaria and fever. So now, that insect, which we call mosquito, when it perch on you, after taking out your blood, which is what it lives on, just like trees and human being, trees will give out oxygen and take in carbon dioxide, while human being will give out carbon dioxide to the trees and take in the oxygen. So that is the same exchange. In life, life is like mutualism. So you give out to take in. So you give out your blood, the mosquito will take out the blood, and what it will give in return will now be this parasite called plasmodium. And when it gets to your bloodstream, it causes that disease condition. Exactly. Life is give and take. Exactly. So what it causes now is what we call malaria. Now, fever is a state where your body temperature rises far above 38.5, or let's say from 37.5 degrees Celsius above. From 37.5 and above, it is regarded that you have already started having fever. So we have the low grade fever, we have the middle grade fever, and we have the high grade fever. We have the low grade fever, we have the middle grade fever, and then we have the high grade fever. I don't know if that makes sense now for those persons that have been referring to malaria as fever and then refer to fever as malaria. Does it make sense to those set of persons? I don't know if we are learning something new today. So, okay, yes. So life is give and take. Yeah, you're correct. So some of these could be that the client will come in, will tell you, I have fever. And what he thinks, he wants you to understand immediately that he has malaria. He wants you to understand that he has malaria. Whereas, not all fever, not all feverish conditions are actually malaria. Not all. For the fact you have headache does not mean you have malaria. That headache might be migraine. And that migraine might be a symptom for hypertension. Is it making sense now? For the fact you have joint pain does not mean that malaria is there. If you are aged, it might be an early symptom, or it might be a symptom of arthritis or osteoporosis and so on. So not all joint pains. Yeah, good evening, make morning with favor. Good evening, good evening. I guess I was on your street this morning, right? Good evening, so happy to have you here, so glad to have you here. This evening we are discussing on health-related content. And for those who are just connecting, on this very channel you'll be getting health-related gist, business-related gist, motivational and religious content. So if you are one who has interest, special interest in those areas, this is the right place for you. All right, I think... Okay, sorry, I received a message now. All right, so those are some of the factors. So if you want to add up for us, please keep adding up. What are those factors? Let me pick another one. Negligence. Now, Favor the Midwife did a discussion the other day where she talked about the Gen Z nurses and so on. Now, it is not just the nurses alone. It's not just the nurses alone. All round other healthcare personnel, even in other fields too. These days, we have people who appreciate or who want shortcuts in almost everything. They want shortcuts in almost everything. So they don't take time. In fact, do you know that those days they used to say the best way or the only way to hide something from an African man is to put it in a book. I think if those persons that brought up that idiom are in this our age, I don't know how they would have even shaped that very idiom, because most of us, that reading culture have died off. The reading culture have died off. And what do you expect? What do you expect now? You will now see that people who were meant to be professionals are now half-baked. They are half-baked because they can't defend. If you want to talk about the theoretical basis, the clinical basis of their practice, they may not be able. Some of them are even jittering and so on. They may not be able to reproduce it. So those are some of the factors that will now lead to this negligence we are seeing here and there. Those are some of the factors. For instance, triage. That word triage, you being able to sort out which condition you should handle first, which symptom takes priority. Most persons don't even know that, or don't even have those skills again. So they might be seeing a case of headache staying here, and a case of severe diarrhea, and another case of extreme bleeding. Because the headache came first, they are handling the headache and they left that client with the bleeding. So malpractice plays a major role. I like an interesting point Marilyn brought up. She said not referring cases. Okay, it's not referring cases the facility cannot handle. Do you know that the economy too plays a role in this point? That facilities, they know that this condition is bigger than them. Instead of them to refer that patient, they want to still handle that patient. Instead of them to refer, they want to still. Life is not a ground, or is not a place for trial and error. Life is not that very, how will I put it? It's not that very vessel for you to be using for trial and error. That's why all your trial and error, you should have done them much before you come into. I know we learn in practice. We learn on the practice, we learn on the go. But there are certain conditions that doesn't require trial and error at all. There are certain conditions. There are certain conditions that doesn't require it. So please, if you have more points, please keep sending them in. Keep sending them in. Why we have poor prognosis? What are those factors responsible for poor prognosis? Poor outcome of certain conditions that at the end of the day, despite all the effort that we put in, we still tend to have high mortality rates. What are those factors? Remember, I shared one of those days that there are certain conditions, including cancer, that if those clients, they presented on time, that they would have either been cured, or they will live longer than when they passed on. So another factor is awareness. Most persons do not have awareness in certain conditions. That's why we have platforms like this to create awareness. And that will even boil down to the religion that I think that was Favor the Midwife that mentioned that earlier. That was what, let me see what my twinnie said earlier. I think she was the one that mentioned that point. Religion, exactly. I don't know, especially in the African setting, we tend to ascribe or attribute almost all conditions to religion. We almost attribute all conditions to religion. So the clients were like, if someone falls down, and then let's say it's related to, I don't know how to put it for us to really understand. Someone was, let's say, going on his or her business and then fall down and slump, that person, if they take that person to the hospital, that the person will not recover. Or if they inject that person, any injection they give to that person, that the person might pass on. For the fact that that person was, and some people will believe that the person was knocked down by a ghost. Many of us have heard that thing before. They believe that the person was knocked down by a ghost. Have we heard that, something like that before? Let me get our responses in the comment box. How many of us have had a discussion like that? That if someone just fall down and slump, that possibly he was knocked down by a ghost. I think our responses is a bit slower. Let me do something like this. Okay. How many of us are still there? How many of us are still there? If you are still there, give me your favorite emoji. If you are still there, give me your favorite emoji. If you are still there, give me your favorite emoji. Give me your favorite emoji if you are still there. I want to believe that we're still there. I don't want to believe that we're not getting me again. If you can still get me, let me know in the comment box. If you can still get me, let me know in the comment box. If you can still get me, let me know in the comment box, please. Could it be network? Could it be network? Could it be network? If you're getting me from your end, let me know in the comment box, please. Let me know in the comment box. If you can get me, let me know in the comment box. Let me not be talking to myself. Let me not be talking to myself. Let me not be talking to myself. Let me know in the comment box, please, if you can get me. Hello, hello, hello. Keep that comment coming. Keep that comment coming. Blessing, are you still there? Marilyn, are you still there? Fabi, are you still there? Real Talk with Mercy, are you still there? Okay, thank you so much, Annie. Thank you so much. I'm so grateful. Thank you so much. Who again is still there? Who again is still there? If you're there, give us that's your favorite emoji. Give us that your favorite emoji. Give us that your favorite emoji if you're still there. All right, thank you so much, Annie. So I was trying to buttress a bit. Yes, I was trying to buttress a bit on a particular point there. So I was talking about that aspect of religion. So most persons, they are so religious that when they are seeing a clean and clear-cut medical condition, they are still ascribing it to religious belief. So this client, he believed that because the man was knocked down, that it was a ghost, so he's not supposed to be injected, not supposed to be admitted. Because of that, do you know that after all our psychoeducation and health education, he still took his client away. And what the client was having was hypertension. It was a chronic form of it. And the BP was very high, very high. So, religion plays a major role. It plays a major role in why we tend to lose certain clients. Religion plays a major role. So if you still have other points for us, please let us know in the comment box. Other points that could be responsible for this poor prognosis, for the poor outcome. If you have other valid points, let us know in the comment box. What are those other factors that could be responsible for poor prognosis? I've talked about late diagnosis, wrong diagnosis. I've talked about inadequate treatment too. Inadequate treatment. Do we know that on a normal day, for an African man to come to the hospital, that that condition is very serious. The condition they are very serious, very, very serious. If not, you won't see them. And then when they now present, the moment they step on their feet, the moment they can now move, they can now go about their life, the next thing they are thinking about is discharge. They want to be discharged. They are no longer patient to complete the course of management. So inadequate treatment could also play a role where we have some of this poor prognosis. And they will go back, they'll be like, I took this treatment, but I treated myself for malaria. Yes, we are not disputing the fact that you treated yourself for malaria, but did you complete the course of treatment? Did you complete the course of management? Poor medication adherence. For those who are for follow-up and they prescribe a particular drug, they say, okay, take it at home, take it this way. Some of them will adjust it to their own favor. So some of them, if it was morning and night, some of them will take it just night, some will take it just morning. It was just morning and it was meant to be taken in the morning. Some of them will take it in the night. Some will take it 1 day in, 2 days out. 1 day in, 3 days off. So some of these factors, they play a role why we have poor prognosis. So poor medication compliance plays a role too. Lack of patient education, which I say awareness too, plays a role. So the healthcare or the clinician or the healthcare providers, not just creating awareness, but each client that comes to the facility, they need some degree of information. They need some degree of information just to help them, so that when they see that, or when they are the treatment, it's lasting a bit longer, they will understand the reason why it is happening that way. They'll get to relate with the reason why it is actually happening that way. So you must educate them. You must educate them. You don't just leave them in the dark. Let them know this is your condition. This is the medication you require. This is the time frame it takes for you to recover. Sorry for that, please. This is the time frame it's supposed. Let me do like my twin sister, who will say that you should stay hydrated. So let me hydrate myself. So I want to believe that we're still here. So the next point to add up, comorbidities. Comorbidities plays a role too. So remember I talked about clients minimizing symptoms. So they might, other than or besides the condition that you are managing, there might also be other conditions, other underlying conditions that you need to let your clinician know. So sometimes they may ask you, is there someone in your family that have diabetes before, or hypertension, or this condition, and so on? And some person will be like, how will I even know? How will I know? They did not tell me. Some will be like, I don't know. Some will be like, they'll just try to minimize this information. Some sincerely know that they have relatives that have some of those conditions, but they don't want to mention. And this, because there are certain conditions that, because of their presence, other conditions will set in. So you don't need to minimize your symptom. The next point is inadequate follow-up care. So your clinician gives you an appointment, please try to keep to the time, keep to the date, keep to the time. Keep to the date, keep to the time. Don't go when you want to go This is another one self we suffer globally. Client will want to come at their own convenience, at their own terms. So for those persons who are just connecting, this is Coach WISDOM AKIBA, a mental health personnel, a public health personnel, a business coach, substance and addiction counselor. And on this channel, content are streamlined to 4 major areas: health, business, motivationals, and religion. So if you are interested in any of them, then this is the right place for you. Do well to hit that subscription button below. Just subscribe so that whenever contents drop or live streams like this, you'll be aware, you'll be notified. And just after you subscribe, turn on your notification bell. If you are yet to give this live stream a thumbs up, do well to double tap on your screen and then give this live stream a thumbs up. For those who are just connecting, please give this live stream a thumbs up. So comorbidities play a role. We're discussing on some of those factors that could lead to poor prognosis of client care. What we simply mean is poor outcome in managing clients. What are those factors? We'll pick a couple of them. Age and frailty plays a role. It plays a role. So the too younger and the too elderly, they need extreme care. They need extreme attention because any moment they can slip off to any zone. Any moment they can slip off. So they could be at risk. They could be some of the reason why. And for the extremely elderly persons, their responses are slow. They are slow. And then their responses to side effects is very high. So because of this, you need to do a lot of adjustment. And these are some of the factors that lead to poor prognosis. Well, poor nutrition and hydration. This one I wouldn't like to buttress too much. At least we're all aware of this very point. There are people who are treating for malaria, for instance, and they are not eating when they are supposed to eat. So and so on. Some of them, they will say, because I've not taken food, so I won't take the medication. And then before they will not eat, it is very late. The time frame doesn't tell you what that drug the physician that prescribed it recommended. So these are some of the factors we should note that they are responsible for the poor prognosis we have been recording. Mental health conditions and comorbidities too. So the mental health condition can even be coming from the relative point of view. There are relatives that can be so disturbing. They can be so disturbing. Once your client is in their care, especially how the economy look like, as long as they have made payment, their client must be fine and must be fine within their own expected number of days. So all you do, keep educating them. Sorry for that, please. So we have substance abuse, we have social isolation. They can also be responsible for poor prognosis. Inadequate pain management. Someone talked about pain earlier. Yes, pain plays a role. Pain plays a role. So inadequate management of this pain could lead to poor prognosis. Limited access to healthcare facility. Remember the scenario I shared earlier. If that man was living close to the facility, maybe let's say the care, they would have done something on time. But before he would travel down, the distance was long. So proximity to the place of care plays a role. I don't know if this class is making sense to us. If it is, let me know in the comment box. Is it making sense to us? How many persons are still there? I'll soon be wrapping up though. That will be in the next 20 minutes at most. I should be wrapping up. I want to see how to pick maybe 4 more points, and then we'll talk about what should we do then, and so on, just in brief. Who is still there? I'm waiting for a response. We have the caregiver factor. Remember where I talked about it, that in the Nigerian system, the number of staff compared to the number of patients are not equitable. So a couple of these healthcare providers, they are tired. Most of them, before you now present with your case, they are already tired, they are exhausted. What do you expect? Emotional outburst. If you are pressuring them too much, you are pressurizing them too much. So those are some of the things you need to understand. And the reason why. Hello, if you're just connecting, please let us have that thumbs up. Let us have the thumbs up. If you're just connecting, let us have the thumbs up, please. If you're just connecting, let us have the thumbs up. And then let me know in the comment box if you are following through. I want to see how to wrap up now. So what do we do then? What do we do? What do we do to cope some of these things? Health awareness, just as we are doing this evening. Health awareness. Going for regular checkup, presenting on time, not being secretive. Not being secretive plays a role. So don't minimize your signs and symptoms. Let your clinician know just how you feel. I don't know how many persons are still there. If you are still there, send us your question or send us your opinion on this very topic. Let us know your opinion on this very topic. If it's making sense to you, if it's not, let us know, please. What's your opinion on this very discussion? Is it worth your time? Was this discussion worth your time? What have you been able to learn? What have you been able to learn in this night discussion? Let us know in the comment box. What have you been able to learn? Thank you so much, my twinnie. Thank you so much. Say the discussion has made sense to her. Thank you so much. Thank you so much for that. I want to see how to be wrapping up now. Where we have further recommendation, please let us know in the comment box. Further recommendation that we could be able to use to promote the prognosis. Do we know that our socioeconomic status too play a role, including where you go and seek care? It plays a role. You will not go and seek care where you know that you cannot afford. So those are some of the reasons. In fact, last year I had very funny scenarios. It was that has to do with snake bite. Do you know as risky and as scary as snake bite is, there were clients that left because they didn't have sufficient finance to sponsor their management. So, what are we saying in essence? Finances too plays a role. Our socioeconomic status plays a role. So please, if you have further contribution, let us know in the comment box. Please. Where you have further contribution, let us know in the comment box, please. Let us know in the comment box. Do you have further contribution? Do you have further questions. I think in the absence of further contribution, in the absence of further contribution, I want to appreciate every one of us that connected to this very night live stream, that gave us a thumbs up, and we're here to support. I want to say that I am very, 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 very grateful. Thank you so much, Nosfavi, for staying this long. Thank you so much, Marilyn. Thank you so much, Blessing. Thank you so much, Annie. Thank you so much, Read Talk with Mercy. Thank you so much, Make Money with Favor. Thank you so much, Afuya. Thank you so much. Let me see, what have I missed? All right. Thank you so much, every one of you, for connecting to this night stream. I'm about drawing the curtain. In the absence of any other question, contribution, suggestion, ideas, anyone you want to share. In the absence of them, I think we are about drawing the curtain here. All right. Thank you so much, my twinnie. Thank you so much. It means a lot to me. Thank you so much. God bless you for the support always. I wish every one of us a restful night. For those persons who are about going to bed, for those persons at work, I wish us a beautiful day at work. For those of us who are just starting the day, I wish us a bright and beautiful day ahead. Do enjoy your day. Do enjoy your day. Do enjoy your day. Thank you so much, everyone, for always supporting. Thank you so much for always supporting. I wish us the best. I wish us God's favor. I wish us God's mercy. I wish us God's blessing. I wish us all that God has in store for good and beautiful hearts like you people. God bless you all. Good night. See us tomorrow, but may not be health-related topic. See us tomorrow, same venue, 9 p.m., same venue. See us tomorrow. Oh, no. Tomorrow won't be 9 p.m. Tomorrow may likely be from 10:30 p.m. West African time. By 10:30 p.m. West African time. That would be the time for tomorrow's meeting. So thank you so much for connecting. Thank you so much, Favi. I'm so grateful. Thank you so much. Thank you so much. Thank you so much. I'm so grateful. It means a lot to me. Thank you so much. God bless us all. God bless us all. Good night, everyone. For those that are about going to bed, have a bright and a beautiful day. For those persons that are just setting out for the day, and for those who are at work, have a calm shift. Take care.